Friends, do you know what is the meaning of this plus sign? If this plus mark is on your chest number, then understand that you are eligible for the medical procedure. And you will have to go through many medical tests. I will tell you about these medical tests in detail. So first of all, don't worry and watch this video completely, and now click subscribe button. Friends, if you have qualified for the NDA written exam and have been recommended for SSB, then you must watch this video. In this, I have told the SSB interview of 5 days in full detail. Friends, as soon as your conference happens on the last day of SSB interview, then you get a little smile on your face. Because after this, you are recommended for medical. And the medical reporting time is 7:30 in the morning, while the reading is left till noon. And don't worry, because you will all be taken from the board to the hospital by bus and will be brought back. You just have to get up a little early in the morning. Before going to the medical first day, you have to pay attention to cleanliness. That is, you have to make yourself clean and go. For example, clean your earwax, clean your nose, clean your teeth, remove the hair of the underarms, cut the nails, and finally take a bath. Do all these basic things before going to the medical. Because there are many such students who get DR due to hair in the underarms due to wax. That's why you have to clean yourself a little and go well dressed. As soon as you report to the military hospital, your document verification is done first. And then you are filled in some form, which takes about 2 to 3 hours. Then you are allotted a new chest number, which has a plus sign on it. And after that, your blood sample and urine sample are taken, which is submitted to the pathology lab. And when the result comes, you are not told that day. Just write in the form you filled in the beginning. After that, no one decides which test is going to be done the next day or the same day. It can be of eye, it can be of ENT. It depends on the nursing assistant that when and which test will they do next. But generally after this, you have an X-ray and an ultrasound. In the X-ray, there is only a chest X-ray, in which they see your rib cage and spinal cord. Is it a crack or a severe spinal injury? Apart from this, if we talk about fracture, then if any of your body parts have broken while playing in childhood, or in the past, there has been a fracture, but now it is absolutely fine. There is no problem in physical movement. And there is no deformation in that part. That is, that part is a little crushed or crooked. If this is not the case, then you do not have to worry because you are close in this test. After the X-ray, you have an ultrasound for which you are told to drink a lot of water so that your urinary bladder is full and your report is clear. In this, generally a stone is checked in the liver and kidney. So this way your first day is complete. It is possible that if your test is not done on the first day, then it is taken on the second day. Second day, that is, your reporting is done on the second day at the same time. Then some basic forms are filled, in which you do not have to make any mistake. And such forms fill you for 2 or 3 days. After this, you generally have an eye test. For the eye test, you are taken to the eye operator. And there your vision and power of the eye is checked by machine. The vision of the eye is the same for the Army, Navy and Air Force. Your vision of one eye should be 6:6 and the vision of the other eye can be 6:9. But if we talk about the power of the eyes, it can be from -2.5 to +3.5 for the Indian Army. It can be from -0.52 +2 for the Indian Air Force. And for the Indian Navy, it can be from -0.75 to +1.5. See, if your glasses are on and the power is in between them, then you will not get any rejection. After checking the vision and power of the eye, doctors make you read different digits and then make you close one eye and read. After this, your color blindness test is done. In this, it is seen that you are able to differentiate the color or not. For this, they turn off the lights in a room and leave it for 5 to 10 minutes. Then they turn on the lights and put some color sheets in front of you. And you have to identify which color it is. Or you are shown some sheets in which alphabets, digits, and some simple shapes are made. You just have to read and tell which alphabet is written in it, which digit is written, and which shape is made. In this way, your color blindness test is done. After doing this test, you are given a dilating eye drop to test something else. For example, there is no spot in your cataract or pupil. After this, if time is left, your ENT test is taken on the same day. Otherwise, it is done on the next day. On the third day, your ENT test is generally done. That is, ear, nose and throat test. For this, you are taken to the ENT department, where both your ears are checked with a machine called an otoscope. Whether the eardrum in the ears is correct or not, whether the wax is clean or not, and many other things are checked. And when everything is correct, you are sent for the nose test. But if there are any defects in your ears, then you get TR in that case, that is, temporary rejection. What is this temporary rejection? I will clear it for you in the video. But friends, in the case of wax, you do not get any TR because it is easily cleared. After this, your nose is tested. In this, a small camera machine is put inside the nose to see if your bone or skin has grown. And there is a common problem in the nose, that is DNS, deviated nasal septum. That is, the bone of the nose is crooked. For this, you get TR, and this problem is very easily cured. And in the same way, your throat is also checked. In this, tonsils and some other things are checked. After this, if there is no problem in your ENT, then you are taken for audiometry. If we talk about audiometry, then it is of two types. One is for the Air Force and the other is for the Army. In the audiometry of the Air Force, you are given a big headphone and its sound has to be identified. In the audiometry of the Army, cardboard is placed in one of your ears and rubbed with a pen. At the same time, a doctor from behind says some words or numbers, 802, which you have to hear and speak. This is to check your hearing ability, which is called whispering in medical language. So this is how your ENT and audiometry ends. After this, you start day 4. In day 4, you have a dental test. For this, you are taken to the dental OPD, and there your teeth are checked and points are given. If there is no problem in your teeth, then you get 22 points, which are the maximum points. However, to pass the dental test, you should have a minimum of 14 points. In this test, your pyrrhia, crossbit, where the teeth are not very bad, and what is the number of teeth, all these things are seen. And according to this, you get points. Generally, dental test is very easy, and in most of the cases, no rejection is found. After this, the next test is medicine, which is called medicinal test. In this, your height, weight, chest and chest expansion are checked. If we talk about male candidates, then generally to go to the army, the minimum height should be 157 centimeters. To go to the navy, it should also be 157 centimeters. And for the flying branch in the Air Force, the minimum height should be 163 centimeters. While for ground duty, the minimum height should be 157.5 centimeters. But if you belong to Lakshadweep, then only height relaxation is available in the Navy and Air Force. If your age is less than 18 years, then you get a relaxation of 1 or 2 centimeters in height because you are in the growing age at this time. Friends, in your screen, you can see the height and weight chart of the male candidates, that how much weight should be in how much height. It doesn't matter if your 5 kg is less or more, but if you are overweight or underweight, you can get TR. If we talk about chest expansion, then at least 5 centimeters should be expanded. And after expanding, your chest should be 81 centimeters. And in this way, your test is completed. And day 4 also ends. The beginning of day 5 is like this. In day 5, you have a surgical test. In this, you are taken to the surgical OPD and a group of some candidates is made. In this test, your knock-knees are checked, the angle between shoulder and hand is checked, which is also called carrying angle. Your sweating hands are checked. Pigeon chest is checked. Then your flat foot is checked. And then your index finger is checked for triggering. The nerves of the feet are also checked. After this, your skin is also checked. In the same way, after being outer surgical, inner surgical is done. In this, your internal parts are checked thoroughly that there is no deformity in the internal parts. So after all these tests, your medical is completed. And the last day, that is day 6, that is conference day. On this day, they tell you how many TRs you have got. And on getting TRs, they explain the further procedure that what you have to do next. But before this, you understand what is TR and PR? TR means temporary rejection. From an example, if you are overweight or your weight is low, then in this case, you are not completely rejected in medical. Instead, you are given 42 days time to correct your weight. And this is called temporary rejection. Take another example. If your carrying angle is high or you sweat a lot in your hands, then in these cases, you get completely rejected in medical. And this is called permanent rejection. Friends, if you want to know in which case you get temporary rejection and in which case you get permanent rejection, then do tell me by commenting so that I can make a video on this topic. Now let's talk about what you have to do next. So they fill you in the form of MRO, in which you have to fill that for what you have got TRs, and in this form, you have to select for which appeal medical board you will be deported. Because there are many appeal medical boards where TRs are appealed. And if you are unfit in the appeal medical board, then you can apply for the review medical board. And if you are unfit in this too, then you will be rejected. And after this, you can't get into the merit list in any way. So this is how your conference ends and medical is also completed. Thanks for watching.